The HIPAA Privacy Rule. HIPAA stands for Health Insurance Portability and Accountability Act. These are federal regulations that deal with a lot of things, but one of the most important is what's called the Privacy Rule. The Privacy Rule specifies some very strict regulations about what you can tell and to whom about an elder's medical condition. The general idea of the Privacy Rule is that an elder's medical information is to be kept confidential from most everyone. This basically means that you cannot tell anyone any details about any resident's medical information without that resident's permission. There are very large fines and civil penalties for disclosing this information improperly, and the federal government has a division that does nothing but investigate HIPAA complaints. And note, in 2010, these fines and penalties were increased and enforcement intensified. Fines can be as high as $50,000 to $100,000, and even prison terms can be meted out in some cases. Each of your residents can make their own decisions about who gets told what about them. The law requires that your elders each be asked about how they want to handle disclosure of their medical situation. Your elders can decide that no information about them be revealed to anyone, that some people can get certain types of information, or everything can be disclosed to anyone. Therefore, you need to know what each of your elders has determined can be disclosed about them. There is something in the HIPAA law called the caregiver exception. This means that caregivers, those who have a direct involvement in the elder's care, can be informed. This law allows for a free exchange of all medical information between caregivers. That includes doctors, nurses, and others who are directly involved in the care of the elder. But note, they must be directly involved in the elder's care in order to get this information. And here's a good question. What can you tell visitors that come by asking about an elder? Well, it's okay to give out directory information to those visitors. The law allows you to give out room number and basic condition of your elders if the visitors ask for the elder by name and if the elder has not objected to giving out this information. But note, your elder has the right to keep all information confidential. If so, you cannot give out even the most basic of information. This is why you need to be familiar with each of your elders' individual requirements. What about family and personal friends? They may be told some medical details if the elder does not object, but only if they are somehow involved in the care of the elder. The best advice is usually to give these persons the least amount of information possible until you know whether or not the elder has an objection to giving out this information. The law is very clear that you cannot give out any medical information about an elder to anyone not authorized to receive it. What this means is that you cannot tell folks around town, for example, that a prominent citizen has been admitted to your facility suffering from Alzheimer's. This is against federal law. The clergy is an exception to these rules. The law specifically gives permission to inform clergy about an elder's condition, room number, and religious affiliation, even if the clergy does not know the elder's name. What happens if the resident cannot give permission? There are times when an elder cannot give permission for any information to be disclosed. They may be too ill, too incapacitated, or have Alzheimer's disease. In this case, caregivers can make the decision that it is in the best interest of the elder and give out this information to family and close personal friends as necessary. You must keep your elders' medical information private. Do such things as keeping a low tone of voice when discussing medical situations. Make sure medical records are secure and locked up. make sure other elders and visitors cannot access medical information, keep phone calls and faxes private, and so on. Here's what you basically need to remember about the HIPAA law. Do not give out any medical information about any of your elders to anyone except involved caregivers unless you know that it's okay. If in doubt, check with your supervisor.